notes, ma'am.
I'll move up and down. It's not too much. You can definitely follow.
Okay.
If you want, you can take notes. It's up to you.
Okay.
Just 2 lines. Once you're done, I'll move on.
Okay.
Sorry. Now where is my cursor and it's moving? I'm sorry.
Yes. Okay.
Okay, moving next.
Okay, ma'am. I would just like to check the second slide, ma'am. Oh, thank you.
Yes.
Okay.
All right. So if both are ready,
Yes.
if you've read and understood, considering it communication skills station, please begin.
Um. Okay. Hello.
Hello.
Hello, sir. I'm Dr. Pinto, one of the surgical resident working here. May I confirm that I'm speaking to the trauma consultant?
Yes, I'm strong consultant.
Sir, I've actually called you regarding a patient with a tibial fracture with cold limbs. So, is it the right time to talk to you, sir?
Okay. Tell me more.
Okay, sir. Okay, sir. So, our patient here is a 20-year-old male who has fallen down from a bike, road traffic accident from a motorbike, and he presented in our emergency department. So on examination, so I've checked the patient on examination. Patient has on abdomen examination, patient has some abrasions in the left flank, and there is distension with a tender abdomen. So, and we have done some imaging as well. So the imaging X-ray shows that there is a right side tibiofibular fracture, and we have done ultrasound as well. Sir, are you able to follow me? Can I proceed?
Yes, please.
Okay. So ultrasound of image of abdomen shows that there is some free fluid with a possible fluid collection inside. And on examination of the extremities, I can see the limb is pulseless, and there is severe worsening pain. So, sir, in
Have you
view
done
of
any
increasing,
bloods?
yes, sir. So I've done some blood investigation, which seems to be completely fine, except the CRP, which is progressively increasing. So, sir, my recommendation would be like, because there is ongoing pain and increasing pain, I feel that there might be a possible vascular injury, and he might require an emergency vascular repair. So in that sense, I would like to get your valuable opinion and transfer, sir.
What is the most urgent in your opinion?
So in this scenario, I would think that there's a possible vascular injury, and that needs an early repair as compared to other problems, sir.
Okay. Could you tell me what is the cause of pulseless foot?
So because there is a traumatic injury to the lower limb, and there is a possible fracture, there is a high risk of compartment syndrome, and that might be the reason why there is a lack of pulse in the lower limb.
Is there any missing investigation you would do other
Yes,
than the labs and the X-ray you had done?
I would also like to get a CT scan of the abdomen done to see for any possible organ injuries in the tummy. Then I would like to get
And
this.
according to this ischemic limb, won't you do another scan for it?
I would like to get a angiogram done to see to assess the vascularity of the limb. To see for vascular compromise. But in this scenario, as it is an emergency, I would, as per clinical, from the clinical investigation, it looks like an emergency. So that can be done after stabilizing the patient, sir.
Okay. Is this patient wearing a neck collar or not?
I would, sorry, sir, I would like to check the patient again, and I'll let you know back, sir.
Okay. Is this patient dehydrated or not?
This patient, I would like to check the patient again, and I'll update you again, sir.
Okay. How would you manage this patient?
First, I would like to inform the I would like to inform the general surgeon as well to have a look on the abdomen.
I mean in the ER. How would you manage it?
Okay, I would start the patient on IV fluids, sir, and go as per the ATLS protocol. And for the, I would like to get an. I would like to continue the IV fluids with fluid challenge to see if there is. I would like to keep the blood pressure on the lower side in view of ongoing bleeding, and then I would like to continue monitoring the vitals, including the urine output, and I would update you again regarding if the fluid challenge doesn't help me.
What is your plan of actions for this patient after the ER management?
I would like to get a vascular surgery review for this patient to get a vascular repair, and do a plan for an exploratory laparotomy later, because there might be a possible splenic injury on the left side in view of the because I can see the abrasion on the left side, and I would like to continue monitoring the patient in ITU if the beds are available, sir.
Okay. What do you do before sending him to the theater?
I would like to inform the theater assistant, and I would like to inform the surgeon and anesthetist as well. And I would like to inform the ITU bed manager to keep the beds available. And I would get the OT listing ready as well, sir.
What will you do for his wound?
I would like to do a wound debridement if there is extensive tissue necrosis is there, and then to secure the do a proper dressing for the wound, sir.
If you call the vascular consultant and he is getting ready, what will you do until he finish? During he
I would,
getting
okay, sir. So I would like to manage the patient in. I'll continue the fluid resuscitation until the patient arrives, and inform the ITU bed manager to keep the beds available.
Where should the debridement occur?
Pardon, sir?
What should the debridement of this wound? You said you will do a debridement. Where
Yes.
should this debridement occur? In the ER, on the operation?
It should be done in the properly in the theater.
Yes. So why are you calling me now?
So in this case, I feel that the vascular repair is an emergency. So I would like you to have a look at the patient in view of a vascular repair as early as possible, sir.
Can't I wait till the morning?
No, sir. The limb is should be salvaged as early as possible, sir.
How will you fix this fracture?
I would like to stabilize by external fixator. I would like to align the fracture by a fracture from externally, and then splint the patient for now. So because that will help me to regain the vascularity and for later exploration, it might help in accessing the wound properly.
You said external fixation. Why will you consider external fixation?
Because that will help in stabilizing the wound for now, stabilizing the bone, and which will help later in exploring the wound, including bone and soft tissue. For approaching the soft tissue and the bones, it'll be easier to access later.
You have to pay attention to where fracture is.
Tibiofibular fracture.
Yes.
So it will help in gaining the vascularity, ma'am.
Why did the general surgeon ask for ultrasound when they felt the abdomen was normal?
There might be a possible splenic injury or some ongoing bleeding in the abdomen because there is a visible abrasion on the left side.
Okay.
And
not sure, ma'am.
Okay, we'll discuss that. There are at least three reasons.
Okay. Whom are the people you might need to call pre or intraoperative, like the specialties you need to call?
Orthopedician, then a vascular surgeon, then general surgeon.
And what?
General surgeon.
Okay.
Yes, and
colorectal, and then I would like to call the anesthetist.
okay.
Let's assume you will call the plastic surgeon too. Why will you call him?
For debridement and coverage, adequate tissue coverage.
Okay.
Graft.
Okay.
Why will you call the general surgeon?
General surgeon, for any bleeding inside, there might be a possible splenic injury, and then for spleen, for managing the abdomen part.
What else?
And this case, for debridement, wound debridement might be done by the general surgeon.
And one more thing.
And I'm sorry, man.
Compartment syndrome.
What is the management of fluid in the abdomen?
Fluid, So here, would start by giving crystalloids with 2 IV white bore cannula on either side with 18G cannula. After taking out the bloods, then I would start with crystalloids on either side with at a rate of 20 ml per kg fluid challenge, and I would assess.
I mean, in the operation room, how will you manage if there is an internal bleeding in the abdomen?
I would check the abdomen by serial monitoring to see for any increase in abdominal girth or any check for abdomen.
And if you find there is an active bleeding, what will you really do?
I would I'll inform my consultant that there is a progressive increasing size, and I would like to get a fast done.
Okay.
To see for any active bleeding inside.
I'm saying to you, there is an active bleeding at the moment. What is the name of the operation you will do with your consultant?
Emergency
exploratory laparoscopy.
Yes.
Okay, great. Let's assume this patient had a metacarpal bone fracture. What will you do for it?
Metacarpal fracture?
In his hand, metacarpal fracture.
Okay, so I would like to put a cast.
No, no cast in the emergency room. You will do a splint, okay? Then what? You will reduce and do a splint. Then you will refer to an orthopedic. So what will you do before this?
Before the cast?
Before the splint, not the cast. Before you made the splint and you reduce the fracture, what will you do?
Pain. I'll splint the wound. Reduce the pain. Painkillers.
What will you tell the patient about it? The patient is a medical student.
I'll tell the patient that there is a possible fracture. I'm sorry.
Okay, you will discuss him about the nature of the complication of the fracture, like malunion and stiffness of the hand and so on.
Yeah. I'll inform the patient about the malunion and possible fracture inside.
Yes.
Okay.
Good. All questions done?
Yes, I think so.
Thank you. Where is my cursor now?